السلام عليكم ورحمة الله وبركاته. حياكم الله جميعا. معكم زميلتكم في السنة الخامسة العنود الحناكي، واليوم راح أتكلم عن موضوع مهم في السايكايتري ألا وهو سكيزوفرينيا. هذه المحاضرة تعطى في روتيشن السايكايتري في سنة خامس وفي بلوك CNS في سنة ثالث. And this is our objectives today, starting with introduction to psychosis, then overview, epidemiology, etiology, diagnosis and the criteria, clinical features, differential diagnosis, prognosis, and the management of schizophrenia. Psychosis is a general term used to describe a distorted perception of reality. Poor reality testing may be accompanied by delusions, perceptual disturbance like illusions or hallucination, and disorganized thinking and behavior. So patient can't distinguish between the reality and the inner world, اللي هي delusions and hallucination that he might experience. delusions بالعربي الضلالات، وتكون على شكل thoughts. So it's a fixed false belief cannot be corrected by proving evidence. Belief that are not based on a fact. So, due to the lack of insight, trying to convince a psychotic person that their delusions are false is almost impossible. No matter of how much evidence you present, they won't change their mind. مهما حاولت تغير رأيه وأقنعته بأشياء منطقية ما راح تغير شيء. مثل لما واحد يقول إن في شريحة مزروعة داخل مخه، يقول تراقبني وتعرف إيش قاعد أفكر فيه، لو تقول له بنسوي لك MRI عشان نثبت لك إن ما في شيء، ما راح تروح delusions. And there are multiple types. عندنا البارانويد لما يعتقد إن في أحد ضده. This individual think other out to get them and trying to follow them, spy on them, steal from them or otherwise harm them. الجرانديوز اللي هي العظمة. Individual believe that they have special power or talent or intelligent. Somatic delusions focus on preoccupation regarding health and organ function. زي لما يعتقد إنه عنده معدتين أو قلبه مو قاعد يدق. Nihilistic اللي هي العدمية. For example, patient feels he's not present. Religious لما يعتقد مثلا إنه هو المهدي المنتظر. Reference, patient believe that some event is uniquely related to them. For example, a TV show character is sending a message to the patient. أو إنه مثلا يروح مكان ويشوف اثنين يتكلمون يعتقد إنهم يقصدونه. Hallucination بالعربي هي الهلاوس. It's a sensory perception without an actual external stimulus. For example, hearing sound when no sound is present. And there are multiple types. Auditory اللي هي hearing, visual seeing, olfactory smelling, tactile touching, gustatory tasting. Illusions هي misinterpretation of actual external stimuli. For example, hearing the wind blowing and thinking it's a bird chirping. So the difference between hallucination and illusions, if there is no stimuli but there is a perception, it's a hallucination. If there is a stimuli but misinterpreted to another thing, it's illusion. Schizophrenia. Schiz mean split, phrenia mean mind. So it's a psychiatric disorder characterized by constellation of abnormalities in thinking, emotion, and behavior. There is no single symptom that is pathognomic, so it's a cluster of symptoms, and there are heterogeneous clinical presentation. Schizophrenia is typically chronic with a significant psychological and medical consequence to the patient, and we can classify the symptoms into three categories. Positive symptoms not present normally in normal individual, like hallucinations, delusions, disorganized thoughts, while the negative symptoms, the absence of normal behavior. يعني normally healthy individual has good speech. In negative symptoms, it will be affected, it will be reduced speech, اللي هي تسمى eulogia. Lack of emotional and facial expression, يكون blunted, emotions restricted. Diminished ability to begin and sustain activities اللي هي avulsion. Decreased ability to find pleasure اللي هي anhedonia. والsocial withdrawal اللي هي asociality. While cognitive deficit is rarely impaired. Epidemiology. Schizophrenia affects approximately 0.3 to 0.7% of people over their lifetime. It's almost equal in both gender, but men tend to present in early to mid-20s, while women present in late 20s. Onset of schizophrenia before age of 15 or after 55 is rare, but it can happen. More than 50% having a history of substance abuse. 90% have nicotine dependence, and for cannabis abuser, the risk of developing schizophrenia increases up to 6 times. So what are the causes of schizophrenia? It can be classified to 4 causes: genetic factors, biochemical factors, neuropathological factors, and psychological factors. Genetics have a significant role. If you have non-twin sibling have schizophrenia, the risk of developing schizophrenia is 8%. If you have a dizygotic twin have schizophrenia, the risk of developing schizophrenia is 12%. If one of the parents have schizophrenia, the risk of developing kid have schizophrenia is 12%. If both of the parents have schizophrenia, the risk of developing kid have the disorder is 40%. And for monozygotic twin, the risk of developing schizophrenia is 47%. Biochemical factors. Dopamine hypothesis is the most famous hypothesis of schizophrenia. The dopamine is a neurotransmitter, and there are 4 dopamine pathways in the brain. عندنا الميزولمبيك responds for positive symptoms. لو البيشنت الدوبامين عنده عالي في الميزولمبيك سيستم، البيشنت بيصير عنده hallucinations, delusions, and disorganized thoughts. الميزوكورتيكال pathway response of negative symptoms. لو البيشنت الدوبامين عنده قليل في الكورتكس يصير عنده negative symptoms. emotions blunted، ما في pleasure، وزي السيمتومز اللي تو ذكرناها في النيجاتيف symptoms. nigrostriatal pathway من خلالها البيشنت develop side effects لما يستخدم antipsychotic، يكون عنده extrapyramidal symptoms والtardive dyskinesia. tubular infundibular pathway من خلالها البيشنت develop side effects لما يستخدم الانتيسايكوتيك اللي هي hyperprolactinemia، يزيد البرولاكتين level. It will cause milk discharge, amenorrhea, sexual problems, and infertility. Neuropathological factors. The most consistent finding is the lateral and the third ventricle enlargement, and they found there are some reduction in cortical volume. Psychosocial factors, stress and childhood trauma. So how to diagnose schizophrenia? According to DSM-5, we should have 2 or more of the following must be present for at least 1 month. يعني لازم يكون عندنا 2 symptoms، واحدة منهم يا delusions يا hallucinations يا disorganized speech، مستمرة positive symptoms على الأقل شهر، لكن total duration أقل شيء 6 شهور. So criteria A is the most important criteria. Criteria B must cause significant social, occupational or functional deterioration. Criteria C, duration of illness for at least 6 months, including at least 1 month of active symptoms that meet criteria A. Criteria D, schizoaffective disorder and mood disorder with psychotic features have been ruled out. Criteria E, symptoms not due to effect of substance or another medical condition. Clinical features. It's a vary from patient to another, but usually appearance, long hair, long nails, dirty clothes, poor eye contact. والspeech يكون disorganized. المود يكون extreme of rage, happiness or anxiety. The affect will be blunted or restricted. And for thoughts and perceptions يكون عندنا paranoid delusions, auditory hallucinations, ideas of reference. Usually the cognitive function will be maintained. Lack of judgment and insight into their disease. They don't believe that they have abnormalities. Differential diagnosis. لما يكون أقل من شهر يعتبر brief psychosis. لما يكون من شهر إلى أقل من 6 شهور يكون schizophreniform. لما يكون 6 شهور وأكثر يعتبر schizophrenia. Other differential diagnoses like substance-induced psychosis, very common in our culture by using amphetamine or cannabis or alcohol. psychosis due to general medical condition like Parkinson's, hyperthyroidism, and other psychotic and psychiatric disorder. We can classify the prognosis into good prognostic factor and poor prognostic factor. For good prognosis, late onset, good support system, being married, having positive symptoms, mood disorder symptoms, especially depressive disorder, acute onset, female gender, few relapses, good premorbid function. Poor prognostic factors like early onset, poor social support, being single or divorced, having negative symptoms, having family history of schizophrenia, gradual onset, male gender, and having many relapses, poor premorbid function, and comorbid substance use. For the management, the indication for hospitalization, diagnostic purpose, if we concern about the patient and other safety, if there's a risk of harming himself or others, and for initiating and stabilize the medication, and short stay 4 to 6 weeks in hospital. It's just effective as long-term hospitalization. عندنا الانتي-psychotic medication الدوبامين receptor antagonist اسمها الثاني first generation typical antipsychotic مثل الهالوبيريدول والكلوروبرمازين والسيروتونين دوبامين receptor antagonist second generation atypical antipsychotic مثل الريسبيريدون والكلوزابين والأولانزابين. Electroconvulsive therapy used for resistant cases. It has minimal side effects, but it needs anesthesia. Side effects of antipsychotic extrapyramidal symptoms dystonia اللي هي تخشب, spasm of the face, neck and tongue, Parkinsonism, resting tremor, rigidity, bradykinesia, والakathisia اللي هي inability to keep still with unpleasant feeling of inner tension. Anticholinergic symptoms, dry mouth, constipation, blurred vision, hyperthermia. Metabolic syndrome ما نحبها عشان it will increase the risk of cardiovascular diseases and type 2 diabetes. Tardive dyskinesia هي involuntary dyskinetic movement usually seen in the face, tongue and head. Neuroleptic malignant syndrome and hyperprolactinemia. So even with medication, 40 to 60% of patients remain significantly impaired after their diagnosis, while 20 to 30% function fairly well in society. About 20% of patients with schizophrenia attempt suicide, and many more experience suicidal ideation. This is my reference. So وصلنا لآخر المحاضرة. الله يعطيكم العافية جميعا. يا رب أنكم استفدتوا. ولو في أي نقطة ما فهمتوها أو أي سؤال يخص هذه المحاضرة أو السايكايتري بشكل عام، هذا إيميلي. حياكم الله والله يوفقكم يا رب وييسر أموركم.